Next on Reboot Your Life.
We celebrate the often unrecognized nurses who make our recovery and health possible, plus a follow-up on an earlier ketamine story with a new breakthrough treatment for substance use disorder.
From Riverside Recovery, it's Reboot Your Life. Experience the ultimate reboot of your journey. Start anew and rediscover you. Transform your story. Rewrite your life. It's Reboot Your Life with Cary Harrison.
From the Riverside Recovery Studios in Tampa, Florida, Cary Harrison with you. And thanks for joining us on Reboot Your Life, where we help you get back the life you love. Well, nursing plays a crucial role in healthcare by providing compassionate care, advocating for patients, and promoting wellness. Generally unsung heroes, nurses are the frontline caretakers of patient care, making a significant impact on the lives of people and communities, and their expertise, their dedication, their empathy, all of that contributes to the overall well-being and recovery of patients across various healthcare settings. During this time of International Nurses Day, we're joined by Dr. Raylene Brooks, Dean of the College of Nursing at the University of Phoenix. Dr. Brooks has a strong background in ICU, in trauma, critical care, and is a distinguished member of various healthcare organizations and a Doris Howell Scholar. Dr. Brooks, we want to welcome you to Reboot Your Life.
Thank you, Cary. Thank you for the opportunity. How are you?
I'm doing great. Thank you so much. Just think, if I keel over on the table, virtually, you can help.
That's why we still need people at the bedside, Cary. We will never be replaced by AI.
But you could at least say, get up, roll to the left. We'll have a better solution. Let's jump into this, because nurses really are the unsung heroes. We deal with them every day. What would a hospital look like? Oh, no nurses today, doctor. Have fun. Slam that door. Uh-oh, big problems. What does a nurse do, and what do they actually, why are they in that clinical setting?
That's a great question, Cary. You know, oftentimes I think about my days working 12-hour shifts on the night shift. And for example, at 3:00 in the morning, it's the nurse and the patient. And in a setting such as critical care, for example, when it's the nurse and that patient, and the nurse's ability to identify signs and symptoms and pathophysiology, lab diagnostic tests, and medications that all affect a patient's declining if they're in compensating. It's that nurse who's that lifeline that makes that phone call. And best believe at 3:00 in the morning, Cary, when we call that surgeon or that physician, they are asking us questions that we need to have answers for. And ultimately, that nurse has an idea of what it is that doctor needs to do to treat this patient. And we provide the data. So it's a very collaborative approach with physicians. We provide the data so that physician can make that ultimate decision about the treatment.
And when we say data, it's like, you know, we always hear, so what's their blood pressure? That actually matters. Very low or no blood pressure. This is a problem. If a doctor walks in and tries to treat a patient without blood pressure, what choices does he have to make without somebody actually having done that? It's the triage sort of it. It's the primary part to figure out, is this creature functioning, and to what degree, so that you, doctor, you can pull out your wrench and make it better. We have a blend of men and women nurses. This traditionally used to be the domain of women. In German, they were called Schwesters or sisters. We still hear sister in some maybe Catholic medical organizations. But now it's like everybody who's skilled and qualified wants to get in on this and help. Is there a difference between male and female nurses that you're seeing?
You know, unfortunately, the male nurses get the short end of the stick when we have to turn a 500-pound patient, Cary, that's on life support. So, for example, when we used to recovery back in the early 90s, for example, and we would recover bariatric surgery patients who, back then, there were no laparoscopic approaches to do the bariatric surgery, and we would do a whole entire fillet straight down the abdomen. So it was a big surgery. Patients came back intubated. We would always ask our men nurses for their muscles and say, hey, can you help me turn my patient? So that's the only difference. Otherwise, it's just a great field for both men and women.
in recovery centers and in everywhere, there are nurses, maybe they're not called that, but it really kind of clinicians, they sort of work the same way to get stuff organized. Without them, the beating heart of an organization simply cannot function reliably. Too much guessing, too much theoretical stuff. And so you really have boots on the ground, and you're right. It can't be replaced by AI. I know many doctors will forbid you, and now don't go look up this syndrome on the internet. But I was going to go home and read it. No, do not do that. I would imagine as nurses, you deal with a lot of patients. Yeah, but the internet said, no.
We do, which is a good thing. We really want informed consumers, right? Patients are consumers of healthcare. And the more informed they are, the better. And nurses can help dispel any questions that they have. It certainly helps with a course of treatment so that when a patient is discharged, for example, they can definitely keep on track by looking up all of the things they need to do in addition to the discharge teaching that nurses provide. So I do feel like they are partners in their own recovery and healthcare, and the more informed, the better. So yeah, it's true. They come very informed, Cary.
I feel, Dr. Raylene Brooks, that sooner or later, we're all going to be encountering nurses as one ripens on the vine of life. So then does it become more likely that you're going to have that interface with a nurse? Maybe more than one time. It's a natural phenomenon. So I think it's kind of important for all of us to understand the relationship between people who are caregivers, who take care, who do a lot of the, let's just say, icky stuff that needs to be done. Maybe you don't see it, maybe you do see it, but these are really incredible foot soldiers in a world of medicine, in a world of psychology, in a world of just betterment for the world. You picked a career in nursing. You could have picked a career in banking. You could have picked a career as flight attendant, but you said nursing, knowing what you were diving into. What's the mindset on that?
That's a great question. I have to share that I am a product of immigrant parents. My father joined the U.S. military in 1963, and he said to us, "It's your responsibility now. I'm sacrificing for our family so that you can improve your life and better generations to come." And so my sister, to your point, my sister is a judge. She's an attorney and a judge in California, and I chose the medical field. And I thought to myself, "Oh, I want to be glamorous with the white caps like my aunts did when they were nurses." And they were actually, to your point, they were caregivers. They worked in the nursing homes and they did all the icky stuff, but it was glamorous. And I thought, what a great career to be able to help people and look so beautiful at the same time.
So you've witnessed an evolution of the nursing profession over the years. Evolution, devolution in one way, starched, crisp uniforms to scrubs, but evolution in what you actually get to do that people didn't used to get to do or didn't even know how to do.
It's so true. Nurses have really improved their skills at the bedside. Even the unlicensed personnel who, to your point, caregive at the bedside, we still depend on those personnel to help us do a blood pressure and identify whether it's high or not and a report up to the nurse. And now the nurse is doing a much deeper dive into clinical judgment assessments so that when we do make that 3:00 phone call to the surgeon, to the doctor, we are their lifeline, the patient's lifeline. So in order for us to have a really good connection, collaborative treatment, and accurate treatment of whatever it is that's ailing the patient, that nurse has to have high skills. So yes, I've seen a huge evolution in clinical judgment, clinical reasoning, not only on the registered nurses side, but also the other levels of nursing.
Cary Harrison with you. This is Reboot Your Life. We're talking to Dr. Raylene Brooks, Dean of the College of Nursing at the University of Phoenix. She's got a strong background in ICU, trauma, critical care. Dr. Brooks, a distinguished member of various healthcare organizations and a Doris Howell Scholar. Dr. Raylene Brooks is a nurse, a professor, an academic leader. And Dr. Brooks, I had an ear surgery recently. I'm one of these weird folks, and you get to see it all. I grew a ligament in my ear somehow after being hit on a motorcycle. So my ear didn't work properly. The bones were moving around properly. That is to say, they had to go in with a laser. And what's on the other side of your ear? Your brain. And the doctor said, well, I'm going to fire a laser in there. I said, but my brain is on the other side. He said, yes. I said, you're going to fire a laser into my brain. He said, yeah, I'm a very good shot. And that made me nervous. And he said, well, no, it's on a tripod. I mean, we lock it down. I said, this is good. Nobody wants a shaky laser firing at anyway, it was a success as far as I can tell. But when I was in there laying out and the nurses had prepped me and they hold your hand and they call you honey. And I mean, really, you're terrified. You're about to, and they're going to put you to sleep. And what if you don't wake up and everyone thinks the same thing? And I get in there and I decide to do a soliloquy for the nurses, the unsung heroes. I just want you all to know that I understand how hard you work and you're unsung heroes and, all of that. And then one of them comes over and just boom, knocks me out. And that was the end of the soliloquy. But I wanted to do my part,
I love it. Thank you for sharing that. And nurses, oftentimes, especially in the critical care setting, patients are intubated, they're sedated, they're with a respirator. They are unable to communicate because of the respirator, the ventilator. Oftentimes, we don't get to see all that. So it's a wonderful story, Cary. I think a lot of times nurses don't get that whole gratitude piece at the end. We just know that at the end of the day, if the patient still has a pulse, a heartbeat, and good blood pressure, we did our job.
Right. And, the only reason I got knocked out is because the anesthesiologist was not included in my song of love. I was talking to the nurses. He was like, just click that thing and boom, I was end of that. Back to business, folks. For those aspiring to become nurses, to help the world as they do in clinical settings, even in home settings, we have nurse next door, we have concierge nursing, we have all kinds of nursing now. What words of wisdom would you impart as the dean of the mothership of teaching people to be nurses?
I would say go with nursing is all heart, and caring and compassion will take you a long way. So if you've got that heart for caring and compassion and wanting to really make a difference and not necessarily see that difference on the, in the future when the patients go home to their families and recover, oftentimes we don't get to see that in nursing. We see them in their acute phase. So just keep in mind, stay the course, know that you do make a difference. And I would say, go at it with all heart, because oftentimes the skill piece is taught to a nurse. The heart and the care and compassion piece, that's innate. That's innate, Cary. So that's all you really need, and some drive and motivation to complete nursing school, as it is tough. It's rigorous. I'm not going to sugarcoat it. Nursing school is rigorous, as it should be, right? Because we are the lifeline for patients.
We'll finish with auguring ahead, looking into the future. We do have AI. It is not going away. It's useful in the medical field. It's useful in some fields. It's not useful in most fields yet, but in your field, very useful. Looking ahead, where do you envision the field of nursing heading in the next 5 or 10 years?
That's a great question. And AI is really helpful at gathering massive data and then funneling it, right? And so, for example, if we have patients coming with multiple symptoms, if we can see a trend earlier by taking all the data from for example, an earache patient, Cary, and we're seeing the same symptoms over and over again, AI can help guide that as a patient calls in, for example, telehealth, and gives these signs and symptoms. They're automated, and then it gets shuffled into the nurse to help diagnose and treat and certainly refer to the physician as needed. So I can definitely see impact of AI in nursing, as a matter of fact, especially in the rural areas where healthcare isn't always available for our population. AI can help if we have a lifeline where we can call, patients can call and actually ask for help, and based on their signs and symptoms, AI can help guide some of that questionnaire and then help, again, funnel it to the healthcare provider that can help diagnose and treat.
Well, I appreciate this, and I'm glad that there is an International Nurses Day that seems to go 365 days now. I'm a fan of whenever you're in front of a nurse, get on bended knee, supplicate, and let them know, because really they're doing the heavy stuff, the heavy lifting, without the big pat on the back that, when the doctor the doctor. The doctor is here. Yeah. Well, the doctor came in later. He's like in the third act, so.
So true.
Yeah.
So true. Thank you. And oftentimes they don't like that phone call, the physicians. I'm not, no disrespect to my MDs out there, but they don't like that phone call at 3:00 in the morning. But the nurse knows that we are not here for anyone else but the patient. We advocate. And so if it's that tough call at 3:00 in the morning and getting yelled at by the physician, we will do it, because at the end of the day, it is up to us to help that patient. We are their advocates, first and foremost.
Well, thank you for coming on today, Dr. Raylene Brooks, Dean of the College of Nursing at the University of Phoenix, with a strong background in ICU, trauma, critical care. Dr. Brooks is a distinguished member of various healthcare organizations and a Doris Howell Scholar. Dr. Raylene Brooks, a nurse, professor, an academic leader, and we want to thank you for bringing nurses into the force so that we can understand this complex set of beings that are out there doing the good work, that now we know who and what they are. We know what they look like, but now we know what they do. Thank you so much.
It was an honor. Thank you, Cary. Have a great day. Thank you so much for the opportunity.
You're very welcome. Bye.
Bye.
Hang on, your reboot reboots in a moment.
How you holding up? Nothing wrong with getting help.
If I promise to look into it, will you drop it and help me build this fence?
Now you need my help.
If you or a veteran you know needs support, don't wait. Reach out. Find resources at va.gov/reach.
Riverside Recovery of Tampa was created to offer state-of-the-art treatment options to people suffering from addiction. The model was developed to meet clients and their families where they're at and provide them with the tools and education needed so that they can achieve long-term recovery. No two people are the same, and no two people have the same experience with addiction. And it is for this reason that we tailor each treatment plan to the unique needs of each individual. Located alongside the Hillsborough River in the heart of Tampa, Riverside Recovery offers the full continuum of care. And what that means is that we offer medical detoxification, residential care, day treatment, intensive outpatient, and outpatient levels of care. The program at Riverside is focused on high-quality clinical care, offered in a safe, comfortable, and serene environment where everyone feels empowered to change the course of their lives. The stigma that surrounds addiction continues to be high on the list of reasons that people don't seek help. At Riverside Recovery, we're working to change the narrative and empower people to recognize addiction as a disease, not a moral failing. We can recover, and we do, as evidenced by the thousands of people who have taken that courageous first step in asking for help. The staff at Riverside understand what it's like to recover. In fact, over 75% of our staff are in long-term recovery. So if you or someone you know needs help and are ready to seek treatment, call Riverside Recovery of Tampa at 1-800-871-5440. That's 800-871-5440. You can learn more about the treatment we provide at rrtampa.com. Again, that's rrtampa.com.
Life 2.0. It's your life and your reboot. It's Reboot Your Life with Cary Harrison.
And from the Riverside Recovery Studios in Tampa, Florida, Cary Harrison with you. And thanks for listening to Reboot Your Life, where we help you get back the life you love through life hacks for recovery, through resilience, battling addiction, expert advice, and stories of our human experience. Well, in the past, we explored some basic uses for the therapeutic drug ketamine. And now there's a new breakthrough suggesting a game-changing regimen for people dealing with substance use disorder. Well, we welcome Dr. Bal Nandra from the Ketamine Centers of Chicago. He's an expert with nearly 2 decades of experience in ketamine infusion therapy and whose leadership is revolutionizing treatments for substance use disorder, for depression also, and for anxiety, chronic pain, and PTSD. We welcome you, Dr. Nandra.
Hi there, Cary. Nice to be here today and happy to join you again.
We're glad to have you here with this really new breakthrough discovery, your process, which you call Recover IV or Recovery or Recover IV.
Yeah, no play on words.
Something. Uses ketamine therapy to help in overcoming alcoholism. Can you tell us how this works?
Yeah, so it's very interesting. It all kind of began many years ago when I started my clinic, maybe 2018, 2019. And it was kind of just, serendipitous kind of anecdotal findings in patients who were treating with ketamine for, mental illness such as depression or PTSD. And, along the course of their treatments, they would just kind of randomly say to us that, oh, hey, by the way, doc, I have like no cravings or urge to drink anymore. And I had the same thing happen with an individual who was a heavy gambler and was being treated for depression. His gambling affliction just kind of vaporized. And so that was back when we were starting to study the effects of ketamine on addiction. And there were some studies coming out of the UK on it showing that it was fairly promising. And so, serendipity is often the way or the avenue to discovering new and exciting and innovative things, as we know.
So what are the effects then of ketamine on addiction, like withdrawal systems?
So ketamine again works. Yeah, so ketamine again modulates that NMDA system of our brains. It's with the glutamate neurotransmitter. And that system itself now with clinical studies behind it has been shown to be somewhat dysfunctional and haywire, I guess, in people with addiction. So ketamine, in a way, stabilizes that system and kind of retrains the circuits of addiction, quote unquote, the craving circuits and all those things. Ketamine kind of disrupts those pathways and can, actually physically reduce cravings as well as withdrawals. We've even seen in some studies in emergency rooms.
Well, Dr. Balanandro, as we look at ketamine and we look at its multiple uses in the past, it has helped with fibromyalgia, it's helped with depression, it's helped with all of these things that we knew about. Now we're finding that it is an ameliorative treatment for substance use disorder. Can ketamine be a transformative treatment for other substance use disorders?
I believe it can be. So the studies out there today have particularly studied alcohol, cocaine, and also heroin, believe it or not. So we've seen pretty promising results and, somewhat comparable results to like spending time in an outpatient rehab center for a month. And that's just after a dose or two of ketamine. So by, modifying and kind of making that treatment course more robust, which is what I've done, I believe that we're going to see even stronger results and more long-term results. And we actually have already seen that in some of our patients.
Ketamine has the, as I understand it, the unique ability to cross the blood-brain barrier. Uniquely, other things just simply don't, and thereby explores the precognitive realms. The part up here, our executive functioning, is it yellow? Is it green? How much of it do I want? Can I navigate through it? A little to the left, a little to the right. Smart part. And it offers insights that traditional medications cannot. Just by the introduction of it, this part of the brain, the executive functioning, actually changes.
It actually does. So ketamine, in general, it's a pretty healthy agent for the brain. And one of the big reasons why it's so effective for treatments like addiction and depression in the long term is its ability to take advantage of your brain's neuroplasticity. And that's really just your brain's ability to change when it's stimulated to do so. And that's what ketamine does. It stimulates growth factors in our brain. And that's what kind of cements in these changes that ketamine is doing in the initial early phases is the long-term effects of that neuroplasticity and neurogenesis is what we call it, where you're actually retraining your brain and forming new neural networks. It's like almost completely. So when we do the addiction treatment, that's the goal too, is not only are we breaking those addictive and craving type of circuits in the brain, but we're actually making them permanently remodel and reform in a positive, healthy way. So we avoid those cravings. And it's pretty remarkable to see our patients and how their visits with our addiction counselor go and how they're actually processing their addiction in an entirely different way than they normally would have.
We're lucky that the world does have traditional addiction treatments that work. They really do. They work in all kinds of great ways. This is let's just say a disruptor in much of that. So I would think that rehabs and treatment centers all over the place are going to very much want to explore this because it changes the dynamic of your basic purpose to be there. And if you can actually really hit that home run, that's got to be just very exciting.
Yeah, and the other difference too is, we're doing this kind of in the real world, right? And you're not staying in an inpatient center for a month or something intensive like that. So, as we know, people often relapse from those programs when they come out of them because they're back in their natural environment and obviously exposed to those triggers and stimuluses and those cravings. Whereas doing it as an outpatient like this, you're actually going back into your real world for the most part. And so I feel like that's even more effective in the long term because it's kind of like a real world treatment with some real world results.
It's definitely a cool way to do it. The benefit for the long term is that people walk out and they just feel so good they want to go back to their old life. And so, a lot of us, like me, do need to be parented or reparented, you might want to say. We're talking to Dr. Balnandra from the Ketamine Centers of Chicago. He's an expert with nearly 2 decades of experience in ketamine infusion therapy and whose leadership is revolutionizing treatments for substance use disorder, for depression, anxiety, chronic pain, and PTSD, a therapy proven to help all ranges of people. Dr. Balnandra, our veterans are among the highest risk for substance use disorder. How do you accommodate their special needs?
Well, we always take special care of our veterans. We are lucky to be involved with a foundation that I started some years ago, and we have a quote unquote veterans fund or arm of that foundation so that our veterans are always taken care of and they'll always pay little to nothing virtually. And we also work with a number of military foundations out there that serve veterans, and they're also very supportive of the treatments that we do and will cover veterans as needed. We're always, veterans to us, our first responders, very, very important.
Are there any risks or side effects associated with using ketamine for addiction treatment?
There isn't really. People think, well, why are you treating controlled substance addiction with another controlled substance? But, in essence, the thing, it's different because ketamine, you're getting it here in a medical setting under very supervised conditions only. Also, ketamine is not physiologically or physically addictive like opiates are or benzodiazepines are. Ketamine, if you stop taking it, you're not going to get withdrawals. You're not going to have any of those things. You're not going to have cravings. You're just going to lose whatever effects you achieve from it over time, potentially. So it's a very safe drug. It's been proven over and over again to be safe. And the other important thing about treating addiction with ketamine is almost all addiction has underlying mental illness. Okay, that's pretty common, and it's kind of a chicken or the egg story, right? What came first, the mental illness or the addiction? We don't, and the both sides are pretty close in most studies as to what came first. But the point is, with ketamine, we already know how effective it is for mental illness and depression. So if somebody has addiction and that, you're kind of wiping it all out at once. And that's exactly what we've been seeing in our patients. It's like, not only are their addiction and their craving symptoms going away, but their depression, their PTSD symptoms, their anxiety symptoms, all those things that can drive an addiction and kind of fuel an addiction, they're also being treated effectively in the background. So it's kind of like 3 or 4 birds with one stone. It's really remarkable.
We all remember Matthew Perry. I don't think anyone's going to forget for some years to come. People listening right now may have only heard the word ketamine in connection with his name. They get confused, and we're talking about a clinical setting. We're talking about FDA approved. We're talking about really something entirely different. Maybe you could just touch on that for a second so people feel clear about it.
Yeah, so, ketamine is FDA approved in the form of a nasal spray, which means obviously that, it's safe also as an IV form. In fact, I think it's far more effective IV than it is nasal. But yes, Matthew Perry, it was a tragic story. He basically had taken a lot of ketamine orally when he was in his hot tub that evening or afternoon. And basically, he ingested about 20 times the amount of ketamine that you would get it like in a ketamine clinic like mine. In fact, his blood concentrations were about 30 times higher than what we would see in my clinic for like a treatment for depression. So he basically gave himself a general anesthetic. Ketamine in huge doses is a general anesthetic. So he gave himself a general anesthetic, and that made him unconscious, and he simply slipped into the water and he drowned. So, they found ketamine in his stomach. His blood levels were very high. It's pretty kind of clear how it all happened, and it's very tragic. But that's why it's very important to go to a clinic that's got a lot of experience, and as providers that are experienced in using ketamine. And we've been doing this for 7 or 8 years now, and have done 15,000 or more treatments. So we've seen it all, and we really know how to take good care of people safely as well as effectively.
That opens up an interesting question. We're talking about how ketamine therapy supports substance use disorder. It actually treats and mitigates, attenuates the cravings, the desire, the thinking that the answer to a problem is to take a drug or take a drink. Does ketamine therapy also support long-term recovery from alcoholism?
It does. So basically what we do, it's similar to what we do for mental illness is, after our initial series of treatments for addiction, which takes, about 4 weeks or so. After that, we would keep very close, keep in touch with our patients, follow up with them, and, maybe periodically give them a booster treatment, just another session every few months. Again, it's a very small price to pay, both time-wise and financially, in order to, really maintain the health of your brain and keep those circuits progressing in the right way, so that you're able to avoid your addiction as well as continually treating that underlying mental illness if there is any.
I remember doing a story during COVID, and we had compiled data through public radio where we were really helping people through COVID. We were locked down all over the country. People couldn't leave. They were stuck at home. So radio listening shot through the roof. Of course, Zoom was born, all these other ways of remote living. But with that remote living came remote drinking in increments we had never seen before. Alcohol drinking, booze sales went up 250% and then kept skyrocketing. And then they just sort of gave up after that. I know the booze companies were thrilled, but the fallout from that is a whole new generation or a whole new tens of thousands of people now who are going to be dealing with stuff. And this is really amazing and profound information, that such a way to interfere with that desire to drink, or just that rhythmic pattern, that hamster wheel over and over again, that when I feel anything, I should have a drink. When I feel anything, I should do a drug. But this literally goes in there and disconnects that part that tells you that's the answer. How do you ensure that these innovative therapies are within reach for all individuals in need? Because some people have money, a lot of people don't.
Yeah, and that becomes that's always a challenge. Of course, we like I said, we do have a foundation that we can often use to supplement somebody's treatment costs, to make it more affordable for them. Unfortunately, insurance isn't covering any of this stuff, and that's always tough. But it's been like that in the addiction world for many, 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 many years. If you want to go to one of these expensive, month-long rehabilitation centers, it's going to cost many thousands of dollars. But that being said, a treatment course like what I've put together is even a fraction of that cost. So, I think that this is actually one of the most affordable treatments that you could actually have for addiction. And not only that, but we use addiction counselors and addiction physician also, that's outside of me, to really support that patient's therapy, as well as, be focused on ketamine. So our therapists are not only addiction counselors, but they're also ketamine experts. So it kind of it's because it's important to be able to prepare somebody for a ketamine infusion and talk to them about their experience, and then use that experience going to the next experience. And so it's really remarkable when you put together a great team, how effective this can all be.
Well, I have to say, under your care, there are a lot of industries where people just hire, like in radio, for instance. Sometimes you get people who they don't know what radio is. They don't even understand audio. Can you push a red button? Sure.
Mm-hmm.
And that's modern recipe for saving money, but you're not cutting corners here. That's the take home. Cary Harrison with you. We're talking to Dr. Bal Nandra from the Ketamine Centers of Chicago, an expert with nearly 2 decades of experience in ketamine infusion therapy, and whose leadership is revolutionizing treatments for substance use disorder, depression, anxiety, chronic pain, PTSD, and therapy proven to help all ranges of people. Trauma and depression, Dr. Nandra, can hinder neuron growth. And here we are. The neurons, the little electrical circuits in our brains that tell us, lift your arm, feel pain, whatever it is, can hinder neuron growth. How does ketamine act as a neural superhero to stimulate growth? And what evidence supports its effectiveness?
Well, the evidence is like everywhere, but what ketamine does is it stimulates a growth factor in our brain. The predominant one is called BDNF, brain-derived neurotrophic factor, and that factor is very potent. And studies have shown, and there are images even in my clinic of pre and post images of a neuron in a brain pre-ketamine with depression, and just 24 hours after one infusion, and it literally shows there's regrowth of lost elements of the nerve and little dendritic spines, we call them, and little elements, and new nerve cells and branches are forming. And that's in as little as 24 hours after one ketamine infusion. So just imagine what's happening after half a dozen or more of these treatments. Your brain is literally rewiring, remodeling, rebooting itself. There's so many ways to put it. And that's what the magic is. That's what gives you the long-term relief, that you're not having to take the drug every day like every other drug we take. You're taking it once a month, once a few months, and that sustains those changes and even improves them over time. So it's literally like something out of a movie. It's remarkable.
We do like the word rebooting, of course, of all the ones you listed. We're going to go with rebooting your life. Just to finish up here and to maintain anonymity, except for those who've been public about having your treatments, like Chicago Cubbies, World Series winners. There's a handful of big deal people who deal with regular big deal problems, like the rest of us who've gone to your treatment, your clinics, had these ketamine treatments, and it has literally rebooted their lives. And they're public about it because they're so grateful. That's what a testimonial.
Yeah, and that's what it takes. More and more people are coming out. I just read this morning that John Legend's wife, she also recently admitted to using ketamine treatments. So, sometimes in our society today, it sometimes takes validation from people like that, whether they're, high profile celebrities, athletes or whatever, to really kind of push something into the mainstream. And so, yeah, it is nice, but, again, it doesn't matter whether you're famous or not famous, rich or not rich. If you need ketamine and you think it's going to help you, you really should consider it.
Well, thank you so much. Appreciate your revisit with us. This latest update, when we first talked to you some time ago, it was really about pain management, PTSD, things that we knew about. But the fact that you can really alter people's connection with their alcoholism, with substance use disorder, whatever drug cravings and the rest of it, this is profound and remarkable, especially during a time when there is so much of it going on and it continues to grow. So I appreciate all your research, Dr. Bal Nandra. And when you're a perfectionist, it doesn't mean that this is like a bad thing. It just means you want to do it right and you want to do it well. But little defeats can just cripple your mission. Yeah. You just decide that the whole thing is impossible, and it was just a little tiny area, a little obstacle. One little obstacle can destroy the whole thing. So if there's ways to empower that brain to realize, to be able to see through it and see the truth, you're going to end up with a much better outcome.
Absolutely. There's this stuff really holds you back, and We see it all the time. I just treated a kid the other day, Saturday, actually, 2 days ago. His parents called me on a Friday night from Milwaukee. So they're, 2.5 hours away. Friend of a friend of a friend of a son of a friend of a friend of a friend type of a thing. And the kid had, he's 38 years old or 36 years old, diagnosed with bipolar when he was in grade school. Okay. On so many medications in grade school that he was so oversedated with medications that he had gotten into 4 car accidents as a kid and had to have surgeries and all this stuff. Battled with bipolar depression his whole life, and then recently he was diagnosed with schizoaffective. 3 weeks ago, he starts cutting and self-harming himself. Yeah. And he's a chef. He's a really nice kid. Just this mental illness is just destroying him. He's been on probably 30 medications over his lifetime. None of them have worked or had horrible side effects or whatever. Pretty much his parents had pretty much thought, well, he's just going to commit suicide. That's it. He was highly suicidal. So the friend of the dad talked to him and said, you got to see Dr. Bell. And the guy's like, what? And he read up on ketamine. They called me right away. I talked to them literally 7:00 Friday night. And they're like, well, when can you get him in? I said, you know what? He's suicidal. He's hurting himself. He needs to get in tomorrow morning. So just bring him in. So I brought him in, did a treatment on him. And I'm not even shitting you. Everything is gone. His one treatment, like 90% relief. The kid with processed traumas from his childhood they didn't even know existed during his treatment. Like, it was amazing. And he came out of this treatment, like, he just like, I don't believe this. What happened just now? He was just like so emotional and emphatic about how everything had just changed in less than an hour, and even yesterday he was feeling amazing. I mean, and we just does one treatment. We have like 6 or so or more to go. So just imagine, the ability to just do that for somebody. His parents are crying. He got home, his mom's bawling because they've never seen him like this. They haven't seen him smile in years. And here he was, just a big grin. That's the kind of stuff that just gets to you every time. That's why we love what we do. It's just unbelievable. And I honestly was nervous. I was thinking, man, this kid's going to be a tough one. But I think I've learned that, there is no such thing anymore. It's like sometimes the toughest ones are the ones who just respond like that, just like that with a big And you're like, what? This blows you away because they're the ones you don't expect to respond. So
they're totally open to it. It's the rough nubbins that are easy to file down because there they are. You don't have to go hunt for them.
It shouldn't be like that, right? Because obviously in this world of psychiatry and medications, he was impossible. But, this was the right tool for him. And this was, the kid's going to go on and live a fantastic life. And he's committed to being better. So it's a great thing. He has a career. He just has to get back into it when he's dialed in again. So it's really, really, really amazing stuff.
You're from the Ketamine Centers of Chicago, an expert with nearly 2 decades of experience in ketamine infusion therapy, and your leadership is revolutionizing treatments for substance use disorder, depression, anxiety, chronic pain, PTSD, a therapy proven to help all ranges of people from veterans to people like you and me. I appreciate your coming on Reboot Your Life today.
Thank you again. It was a pleasure to be here, Cary.
So how's civilian life treating you?
It's fine.
When I got out, I didn't want to admit that there was anything wrong because I felt like a failure.
Maybe you are fine. But if you're not, it's okay. Thank you.
Veterans, find resources at va.gov/reach.
Are you familiar with Riverside Recovery of Tampa? Well, they offer a profound, all-embracing approach to addiction treatment. With a dedicated team of empathetic professionals, Riverside Recovery is committed to guiding individuals on their path to enduring recovery, using a variety of science-backed therapies, counseling, and support services. Riverside Recovery values the individuality of every recovery journey. Their tailored treatment plans respond to the specific needs, the hurdles, the goals of each resident, providing effective aid regardless of whether you're taking your first steps in recovery or maintaining your progress. With Riverside, recovery isn't just achievable, it's an influential journey towards a healthier, brighter future. The testimonials of those who've undergone treatment there are evidence of rediscovered self-worth and potential. Located on the tranquil Hillsborough River of Tampa, Riverside serves as a peaceful haven, promoting self-discovery and healing. They acknowledge that recovery is about more than just overcoming difficulties. It's also about finding your innate strength and resilience. The Riverside Recovery's committed team are your empathetic allies in your recovery journey. They comprehend that genuine healing involves the mind, the body, and the spirit, meticulously dealing with all facets of addiction. You can discover more at rrtampa.com. That's rrtampa.com. Or reach out at 1-800-871-5440. That's 800-871-5440. 800-871-5440 or rrtampa.com.
You can tweet us anytime on X at Reboot Your Life.
Life 2.0. It's your life and your reboot. It's Reboot Your Life with Cary Harrison.
In Kosovo, meeting with a woman who came from a world so very different than mine, she gave me a vial of lip gloss. This small token and gesture has just stuck with me forever. Then in Afghanistan, the abaya, it's a reminder of a time in my life that I'm proud of, and a reminder today to keep perspective in my life.
Hi, I'm Shane Brendan. As a veteran, I understand how objects we brought back from service can be so meaningful. They can remind us why we served and what we did, or help us transition back to civilian life. Today I talk with a veteran whose objects remind her how people can connect with one another, despite coming from different backgrounds and circumstances.
My name is Clara Driscoll. I retired from the Army as a lieutenant colonel. I had always had a lot of respect for people in the military, so I joined the Army after college.
Did you have any expectations of what your service would be like?
I probably had a romanticized view of it. I thought I would develop this bearing that I didn't really have. I guess I thought maybe I would become a more focused and serious person, a braver person, and I was very interested in just the adventures that I imagined would come with it. Pretty soon out of the gate, I deployed to Kosovo. I was at a small combat outpost overlooking the Presevo Valley. And that was the site at the time of still kind of an active insurgency. So it was important just to kind of be in the vicinity. I was fortunate enough to meet this woman. She was not fluent in English, and I think I know one word in Albanian, which is, thank you. But so it was a little broken conversation, lots of hand gestures. In the course of this conversation, she gave me a vial of lip gloss.
Why do you think she gave you the lip gloss in the first place?
I think she probably had only really interacted with mostly male soldiers, but here was a female soldier. Maybe she was trying to also make a connection with me. It was just a very touching thing. I so appreciated it, and obviously I'm still thinking about it 21 years later.
How many years later were you deployed to Afghanistan?
Kosovo was in 2001 and Afghanistan was 2011, so 10 years. When I went to Afghanistan in 2011, my sole focus was the civil population in Afghanistan, recognizing and working within the boundaries of culture.
Let's talk a little bit about the abaya. Could you describe it a little bit, what it looks like?
I bought it in Qatar, but with the intent of wearing it when I deployed to the Middle East. The abaya I have has two components. One is a headscarf, and then the other is just a loose-fitting overcoat. It was kind of appropriate for the occasion of what I was doing. I thought it was a lovely garment as well.
How did it make you feel wearing it?
When you go over there and you're just encased in all this body armor and you've got sunglasses on, there's no real opportunity for a human connection on your part or theirs. But when you intelligently peel a few of these layers away and are wearing a piece of clothing that's recognized, I think that facilitates more just interaction, understanding, and maybe to some degree, candor with the person you're talking to. It kind of infuses me maybe with a bit of humility. reminds me that you cannot go over there and superimpose a Western solution to an Afghan problem. So wearing it would remind me that you had to work within the culture and the lens of the Afghans to be effective.
The lip gloss and the abaya, how do those two things play into the way you view the world now?
I think those two items serve as a daily reminder of the world is so much bigger than the little lens that we have. They remind me to keep my perspective on how fortunate I am and my family is. It grounds me, and not only then, but in most things that I encounter in life when I'm interacting with someone who's very different than I am. They remind me to stay humble, to have some humility, and the importance of empathy when dealing with others, especially other cultures.
Learn more at rrtampa.com. Reboot your life today.
Well, I was homeschooled in high school, and it was really difficult for me to meet people, and I went to high school just for 1 year into public school. I remember just walking in. It was first or second day of school, and I'm not kidding, I had a PB&J sandwich, and I go to the bathroom to eat because I didn't want to be seen. I felt like people were laughing at me. I was the new girl. And who wants to be friends with the new girl? I had to do my own thing. I started writing songs. I just got in my own little cocoon. I come from an Albanian family where we share all of our emotions, and it's taught me to really be helpful and reach out to someone if they're not like that. To say, hey, I know you're feeling bad about this certain thing, but don't put yourself down. You can't just focus on that one moment. And I would tell my friends that and my cousins when I saw they were down and they didn't feel good and didn't want to talk about their emotions, because I think it's super important to talk with somebody. I think it's important to help people when you see they're down. It doesn't have to be shopping. It could be going to watch a movie with your friend, or taking your friend out to dinner, or taking your friend for a walk just to talk. You can really help a lot of people just by knocking on their door and seeing how they are. A text like, hey, how are you doing? Make it about them. Reach out. I know I keep saying this, but it's so important. If you think your friend is struggling with mental health, reach out and start a conversation. For more tips, visit seizetheawkward.org.
Learn more at rrtampa.com. Reboot your life today.
Do you owe $10,000 or more to the IRS?
Then get on board with the Tax Admiral and let us steer your way to financial freedom.
Helping people clean up their mess with the IRS.
If you owe $10,000 or more to the IRS, are facing an audit, a lien, or levy, then call me right away. You're in charge with the Tax Admiral. Call me now for your free emergency consultation.
Call 855-898-0188.
Everybody wants cheap airfare, but where do you find it? You call Low Cost Airlines. They specialize in cheap flights, discount hotel rooms, cheap car rental rates, and with a best price guarantee. If you want the lowest prices on your airline tickets or other travel services, call now. That's right, call. That's the only way to get these rates. Experts are standing by 24/7 to get you the cheapest airfare and hotel rates available. So don't wait. Call now.